Welcome back to another COVID-19 Franchise Leaders Respond. I'm your host, Red Boswell, president of, where are we? There we are, IFPG, and switched it around, getting crazy now. Hey, we are joined today by a true franchise leader, Miss Emma Dickison. Emma is president, CEO of Home Helpers, one of the largest senior care franchises in the world, and she's also president of the national association that represents all the home service industries, and I don't even know the name of it, but it's a big one. Emma, thanks so much for jumping on here today.
Thank you, Red. It really is a pleasure to spend some time with you.
Thank you. Well, how are you and the whole crew doing? Your family staying safe and healthy?
Yes, we are. We are practicing social distancing as everyone else is throughout the country, trying to help flatten the curve. And so far, the family is doing very well. We have not been affected or shown symptoms of any of the COVID-19 symptoms. And luckily, the staff, we've been teleworking since mid-March. The staff is all healthy. We're all teleworking. No one has shown any symptoms, and we're just incredibly grateful that we're able to work in the environment we are, continue to lead our franchisees in this time, and all stay healthy. And although we do look forward to the day when we all get back together.
Oh boy, don't we all? Looking forward to it big time. I think that will be the record month for hugs. Just seeing everybody again. Hey, I totally botched up. Sorry, this is my MO. I botched up your chairwoman of the what is it?
The Home Care Association of America. I'm president of the board of directors. It's the largest private duty trade association for senior care in the United States.
See, I couldn't have messed that up even worse than I did. Well, thank you for saying that for me. Appreciate you sharing that. Okay, so help us understand. You're in a sector that tends to be doing pretty good. How has Home Helpers been impacted? And then we can talk about how y'all responded.
Sure. So, home care is what we'll call home-based care, is the first line of defense in the healthcare continuum. We take care of an aging population, which certainly has been over-indexed in this pandemic as being at risk. We take care of the disabled, medically frail, no matter what their age. And so for us, this pandemic has represented both crises, of course, and opportunity. We have the opportunity to help flatten the curve for this pandemic and keep our aging population at home in a one-to-one care setting, which is the least risk for them to be able to continue to have care services and hopefully mitigate their need to go to the hospital or other institutional settings. And so the work that our caregivers have been doing is just amazing.
And help us understand size-wise, to put it in perspective. How many caregivers, how many franchisees? Are you just North America? How do you stretch out?
Just North America. We have about 320 franchisees in 43 states. We provide services in more than 1,000 communities today. And we continue to grow, of course, and want to have the opportunity to bring Home Helpers home care and the exceptional care that our caregivers provide to all communities that don't have them. Currently, we have, on any given day, probably around 10,000 caregivers that are working across the country in those various communities.
Wow. Those are life changers. Those are absolutely critical needs. So I assume you're seeing a bit of an uptick. How is it being, how's it really impacting you? And by the way, I've even been hearing that folks are pulling at a record, like never seen before, pulling out of the old folks' homes, and I'm not very PC, the senior care facilities and bringing them home. And no one wants to benefit from a crisis like this, but you are being a blessing to even more than ever.
Yeah, we are. I think in the early days when there was so many unknowns, we had certainly clients that don't have a lot of care going on in the home, where they might reduce or suspend care, not wanting to potentially bring in the virus. However, they find that, as we've educated them, our caregivers have always practiced and been trained on the appropriate infectious control They practice safety in the home every single day. We retrain them all very clearly with CDC guidelines, and we made personal protective equipment part of our tapestry. And so being able to help our clients understand that they really still are in the safest possible setting. Those who need care to stay out of facilities, they continue to get the care. And we are seeing two things really. One, where families are bringing their loved ones home when they can medically be able to do so, and they're needing help to maintain that care for their loved one. And the other thing that we're seeing is the work that we do in facilities where there may be multiple agencies that are working in that facility, where there's an agency that says, hey, listen, we're not going to do care here for now, we're going to suspend that. Those facilities are coming and saying, hey, we've got this need, can you step up? So it really is a situation where, while it's a terrible situation to have to live through, home care is such a vital part of this pandemic to be able to help mitigate it and reduce that and flatten that curve, that we are seeing opportunity.
So when a facility says to home helpers, can you step up? What does that mean? You're actually going into the facility and helping there, not just at home?
Yeah, we do that today. We
Oh,
have arrangements with facilities all over the country where we help supplement the care. They may have trouble staffing, and so we will provide caregivers in the facilities to be able to help them. And if they have multiple agencies that are doing that, if one steps out, they still have the need. The other nice thing that I think that we have that many of my friendly competitors don't is we have what we call an at-your-service concierge program that's designed specifically for independent living facilities. Those facilities, by their charter, can't provide our services, but they certainly have a desire to keep their residents there for as long as possible. So we have arrangements where we have offices in those facilities. We can provide care in as little as 15-minute increments or hours and hours and hours to be able to help satisfy the needs of those independent living facilities through a concierge program.
fascinating. I have not heard of that.
Yeah, it's something that's unique for us.
Fortunately, I haven't had a need yet with my folks. It's praying that continue. Well, help us understand any technology changes, how have you at corporate changed how you do business, maybe from a support, maybe from a training, maybe communication? Help franchisors out there learn from what you guys are doing differently.
So, really communication. And there has to be frequent communication, and there has to be in multiple mediums. You can't just rely on any one medium to do so. We have daily communication going out to our franchisees. I do 2 calls a week with them, specifically designed right now around COVID-19, although we are starting to again remind them of all of the things that are coming forward in the future that we had already had planned that again truly differentiate us in this industry. We have provided them summaries of all the legislation, the different benefits and programs that are available, help them tap into those, help to provide personal protective equipment. We have supplemented. We are big on technology anyway. We have another portfolio called Direct Link, which is our medical alert type of technology, personal emergency response systems, medication management, fall detection, GPS technology if you have a loved one that has Alzheimer's and dementia. And so we've stepped up that. We even incorporate what we call wellness checks, which is when we don't have a caregiver in the home, but we want to be able to check and make sure that loved ones are safe and that they're doing the things they need to do. So we have that opportunity, and we've enhanced that for our franchisees. And we've just really provided a nice bevy of resources and tools and communication and assets for our franchisees to use to make sure that they can continue to provide exceptional care to the clients that they serve and the communities that they employ so many people.
Well, I couldn't agree more with communication. And now more than ever, communication is so key. I'm talking to franchisors having calls every day with their
Yeah.
franchisees. And you know, the franchisees are listening because they want that guidance. When I was a franchisor a decade and two ago, I remember talking to franchisees over and over and say, I told you guys this. And like, well, we didn't hear it.
Yeah.
You're telling me I trained you on it when you became a franchisee. It's on our homepage of your franchisee website. And they start going through. It was in 3 newsletters. It was on our training call this past week. Your area support team told you it. You got to keep communicating. There's no
It
such
is.
thing as over communication in franchising when you're trying to get an important message across.
And absent of information, we all tend to go to the worst possible place, right? And so making sure that there's transparency, that, I mean, we have talked in detail about the offices that are really positively up, those who may be struggling a little bit, just anything and everything related to the business to help them make better business decisions during this time and have the appropriate resources that they need to continue to be just exceptional in their communities. We find that is just a primary role of a franchisor. And I've been in franchising like you, Red, for now 30 years. I know I don't look that old, but I have been here 30 years. And I think, and I've seen economic downturns in the past, as you have, and I see where this really shows good quality, exceptional franchisors of choice. They really shine. And it really separates the true leaders from the not. And it's not that that's a bad thing. It's, you know, Home Helpers has been around 22 years. We've got a lot of experience here.
Yeah, we both started in 4th grade, didn't we? So
That's exactly right.
we've heard that a lot about communication, about training, about stepping up. There are some franchisors that just throw their hands up. And heck, let's be real, there's some broker groups that just throw their hands up and say, well, I'm going to go to the beach and hopefully we'll make it through this. You know, while others will dive in and say, no Zor left behind. That's one of our rally cries. And franchising stronger together, the hashtag about rallying the troops, finding best practices, sharing them. You know what? You got every one of your competitors is going to watch this today, and you're going to be teaching some of the best practices that you, a franchisor, are doing for your franchisees, and they're going to learn from it, and you don't care because it's about helping each other grow and survive.
Exactly. One other thing I forgot to mention early on when this started, we were one of the first franchisors that I'm aware of that went to our franchisees and said, listen, we know tough times are coming. We're going to help be a bridge until we figure out what the legislation is. And we gave deferments and waivers, deferments on royalties and waivers on our National Branding Fund investments for a period of time to help them bridge the gap until they could we could figure out what the legislative opportunities were going to be to help them get to the other side. And I think that, you know, I can generally say that doing that early with our franchisees during this time was just the right, it was the right thing to do. And it really spoke volumes to them about how committed we continue to be to help drive and help them be successful.
Amen. Now, I talk to franchisors pretty much every hour of the day and doing these videos, but then lots of calls, one-on-ones, me checking in with them checking in with us. And it blows my mind. You think, you know, you've been at it a while. We've been in franchising a while, and some of this is just second nature. You know how to handle some of these things. I've talked to franchisors who never even heard of the word deferment. They had no clue that they just thought, well, do I stop charging royalties? Well, no, you can defer. What does that mean? And so things like this, the most elementary things we need to be telling folks, because, you know, a franchisor, well, I can't exist, I can't survive without royalties. Well, could you survive 4 weeks with half royalties? Well, yeah, maybe. Okay, so how about defer half of it? What does that mean? So let's not hold back, you know, giving some elementary things that we think are elementary advice. Some could be a absolute lifesaver. You know what? In fact, back in 2007, I was at a CEO retreat with the IFA, and the great Gordon from Sport Clips, we get to dinner a little early, and he just sat there. Well, Red got his cowboy hat on. What's your biggest issue right now? What you struggling with? Man, I had one on the tip of my tongue. I couldn't stop thinking about it. It was an issue, and I told him it. And in about 15 seconds flat, he had fixed it for me. And it was, as I look back on it 13 years later, I'm like, that was the most elementary, simple answer ever. Why did I not think of that? But I was a fairly new Zor in the heat of the battle, couldn't see the forest for the trees. And so seeking wise counsel like yourself to give guidance, even if it's elementary, can be such a game changer for a lot of franchisors out there.
Yeah.
Emma, how about any examples of triumph? Any franchisees out there that you can point to and say, they did this, and that's been such a blessing, or wasn't it cool that they were able to pivot and do that? Anything, I didn't prep you on this, but anything you can share in that realm?
So absolutely. I think, you find out, as I said, during these times, how to get better. And we've had franchisees that have really stepped up in their community. Not only have they sourced personal protective equipment for themselves, specifically the three-ply surgical masks, but they've handed them out in their community. They have put together food opportunities for those for seniors. We actually have, as part of our platform and program, it's not just in-home care for us when we have a caregiver in the home. As I mentioned, it's wellness checks, it's technology, but we also have a nutrition partner that helps us with aging, that's specifically designed with all kinds of different diet needs out there. And so helping in the community source food for those, for children and seniors. We've had so many people step up in so many ways that as they've looked at how can we be a resource, not just for our clients, but for our communities who need us right now. Home care has been a part of the healthcare continuum. However, it's sometimes seen as it's not healthcare. And so that's not true, though. We are part of the healthcare continuum, and we are that first line of defense. And right now, communities are seeing that all across the country, because we are able to step in and in need, when you're bringing that loved one home from that skilled nursing facility or that assisted living facility, there's resources to help you, and our team is ready to step in. And so we talk about total care. We don't just talk about in-home care. We provide total care. If your home needs bars and devices to help make it easier for you to be there, we have resources that in every community that can be pulled in to outfit that home. It's not something we do ourselves, but we have relationships there that enables that loved one to stay at home longer. So those are the kinds of things that our community involvement really shows in these times of crises.
And that shows strength of a franchisor and the franchise network. I would hate to be a mom and pop today more than ever.
Well, I always use and don't mean to cut you off, Red, but I always use from day one when I walked in the door at Home Helpers, I've often cited this: sticks in a bundle remain unbroken. And it's an Ethiopian proverb. And I think about franchising in that way. In a brand, a lot of sticks bound together. And when you bind them together with that strong rope, you can't break them. And I would not, especially in our industry today, want to be an independent, although franchise is all about, individually owned and operated, but you have a brand network behind you that can help you through the advocacy and the research and development and the marketing messages and all of those things. If you were trying to do this on your own today, oh my goodness, it would be awfully hard and much more expensive.
Yes, it would, and the margins would be so much tighter. That's a biblical proverb too. A cord of three isn't easily broken.
Yep.
What about FranDev? You've got, I said each time, you've got the ones that were in the process. So 4, 5, 6 weeks ago, they were already in process. Love to hear how they have reacted to this. Have they run for the hills? Have they slowed down and paused? Or have they gone forward with a close? And then we can also talk about new franchise development pipeline and how that's been impacted.
It's a great question. So yes, we at Home Helpers have a lot of interest. We want more. We're looking for really good, qualified, buyers that we can award to that have our goal of mission and vision. But for those that were in the pipeline, they have continued on. We've not had anybody that has eliminated from the pipeline because of COVID-19, and we do continue to close deals. So that's great news. As we look at the pipeline of what continues to come in leads week over week, we're still holding very strong. And that held true in 2008 and 2. Those were years, you were a franchisor at the time, we had really good franchise development years in 07, 08, 09, and 10. And that was because of this economic downturn. Now, this is a different economic downturn, right? This is a health-related one, where the other, it was other economic business factors. However, so we're looking at it very closely. To date, though, our pipeline and our lead flow has continued very strong, which we're very happy about.
Yes, you're very fortunate. Now, we have seen on our end, with 570 something consultants or franchise brokers, our territory checks, that's one of the metrics we monitor, the territory checks, checking in with franchisors to see if a territory is available before they present a brand. That has stayed relatively consistent as well. We looked at the first half of April, first half of March, first half of February, compared the numbers, and we were relieved to see pretty steady, maybe a couple percentage points down, but overall steady. And boy, between y'all and us, there are not a whole lot of industries that can say that.
No, there's not.
So real blessing.
I would shudder to be in some of the franchise industries today that, are literally, their doors are shut. We are not, our doors are not shut. We are open 24 hours a day, 7 days a week, and we are actively hiring, which is the other key component of this.
Yes, and never been a better time to find a good pool of available folks to hire. Now, maybe not in your particular category, but boy, there's a whole lot of folks hurting, looking for a job at the moment. And thankfully, when the job market is bad, franchising has an inverse relationship. So franchising is seeing some very good times from a lead flow, and I think we're just at the forefront of where that's going. So excited about that for all our franchise friends out there. Well, Emma, as we wrap up, any closing comments, thoughts, advice, input for those franchisors out there looking for guidance?
Always. I think, to your point, you always want to hear from others, and I like hearing. I get so much back as well. It really is around staying engaged, staying in front of your franchise network, and communicating to them via channels like Zoom, via email, picking up the phone and calling, gathering information, and sharing. More importantly, sharing best practices. What's working? What should we not be doing? What would be the wrong investment to make, especially right now? And then reassuring, giving them confidence that the brand is staying on top, and that they have a spirit of innovation, and that they're going to continue to move their brand forward. Anyone who is a franchisee wants to have a strong confidence in the leadership, and you have to be present to do that. And they also want to see that you have a spirit of innovation, because brands that don't have a spirit of innovation, they aren't around. There's a quote in a book that I read that the book was called Change is Good, You Go First. And in that book, there's a quote that says, if you don't like change, you'll like irrelevance a lot less. And that's what I think of with a spirit of innovation. You have to constantly be looking at trends and reinventing and pivoting, to use some of the language we used earlier, to maximize the return that you can for your brand. And so communication, transparency, and spirit of innovation. Now,
Change is Good, You Go First. Wasn't that a book, Tom?
Yes, Tom Feltenstein.
Thank you. Just got drawn a blank. Tom Feltenstein, the legend in franchise. We got to get Tom on here. You know what?
You should. You should. I read that book. Wasn't long after I started here at Home Helpers, and it was that quote, that line. If you don't like change, you'll like irrelevance a lot less. Just really has driven. I think about brands like Burger Chef. I don't know if you remember Burger Chef. It's a brand in the South. Roy Rogers, Howard Johnson's, Scottish Inn. I mean, those are brands that they didn't innovate. And so I think that's important, that as you're leading through crises, you're not losing sight of what your brand is going to look like on the other side of it, and be ready to launch forward and continue your vision.
Well,
You've got to be that message.
just an hour ago on LinkedIn, I posted just, weird ideas come to me, and I posted this one. The word of the year for entrepreneurs and franchisors: pivot. I hear it in every conversation. Every one of these is like number 28 or something. Everybody's talking, we pivoted. We did this, we were going this, and pivot. I don't know that I heard pivot once a month before this month, and now I'm hearing it once every other hour. So important to do.
The other one I'm hearing is inflection point. We're at an inflection point.
Yes. That's a big word. Inflection point. I like that. 2 words. Awesome, Emma. Well, thank you. Hey, a bit of trivia as we just go off track here, little rabbit trail. You know who Tom is related to? The great Sid Feltenstein.
Yes, I
How
did
about
know that.
Or is it Feltenstein? I don't know.
We know they're
Epstein,
related.
Epstein. Yes. All right, Emma, thank you so much. Emma Dickison, CEO, President of Home Helpers, joined us for COVID-19 Franchise Leaders Respond. Thanks again. I'm Red Boswell, President of IFPG. We'll see you on the next one.